Hello, how is everybody today? Welcome back to the BioNexus Health podcast series, Autism Uprooted. Today we are doing a little Autism Parents Roundtable. We have some families from Somalia and Kenya, and I have been requested to do an open forum today for questions and answers, and I'm very happy to do that. So welcome to today's podcast. And let's proceed and meet the families.
Welcome to part 1 of Autism Moms Roundtable on the BioNexus Health podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician and author. And now here's your host of BioNexus Health podcast, Dr. Jodie A. Dashore.
Yes, Khadija, go ahead.
So I'm almost done. I have one more test to do.
Yes.
Which is the Lyme test. But I have so much difficulty with my kiddo drinking water. I don't know what to do, honest to God. He drinks probably 60 cc a day, which is, it's nothing.
It's like people today.
So I'm really struggling with that part, and I'm trying to stay away from anything with sugar, like juices.
Okay.
He loves sweet. He'll drink
Yes,
juice. If I give him juice, he'll drink it. But I'm trying to stay away from that because I don't want to deal with yeast overgrowing again.
Right.
Yeah.
Okay. So Khadija, kids not drinking enough water is a common problem with autistic children. So if you can mix like 80% water with 20% juice, that's okay to do. Okay. Now, sometimes if you mix in, say, for example, my local Whole Foods market here, they have what is called as sparkling cider, right? So it is, it's not sparkling wine, obviously, it's sparkling cider. So it's apple cider, right, which has bubbles in it. So if you want to mix like, 80% water, 20% sparkling cider, it may give him that sensory stimulation in the mouth as well. So that might be helpful. Oh, there's a lot more people joining now. Good.
So I can find that sparkling water in your store, right?
No, not in my store. No, this is at any organic grocery store.
Okay.
So where are you located?
Washington State.
Washington State, right. Oh, yes, of course. So you have Whole Foods Market?
We do.
Okay, so go there and look for organic sparkling cider.
Organic.
All right, so that's one option, right? Now, another option is that give him juices of fruits and vegetables that are high in water, like for example, cucumber, celery. Okay. So if you make a juice from cucumbers and celery, and to that, if you add maybe half of a green apple, it's going to give it that sweetness. Right? And then add coconut water and then add regular water. So you understand what I'm saying?
Yes.
Perfect. So that is a really great recipe to make kids drink water. And again, try to give them fruits and vegetables high in water as well.
Okay.
And you know what? Also, Khadija.
Yes.
You don't have to worry about yeast overgrowth once you are on the full BioNexus protocol, because, the underlying issues will be addressed.
Okay.
Right? So overall, just remember that your child will be able to eat, unless there are actual allergies, your child will be able to eat all fruits and vegetables before we are done. So that's one thing that is important. With my son, we were even able to get rid of lots of allergies, not just sensitivities. We got rid of all sensitivities. In the beginning, the food allergy testing showed like lots of problems. but it was all inflammation because of underlying PANDAS issues.
Okay.
Okay.
That's exactly what my son has, actually.
Okay.
All these allergies and sensitivities.
Okay. Yeah. Now, the real allergies were, for Brian, for my son, were like tree nuts. So we had issues and some seeds, like allergy issues, where you get hives, and throat is itchy and sneezing. So that kind of real, true allergy issues we had with like tree nuts, sesame seeds as well. Now we were able to add back in almonds, pecans, peanuts without any issues, as well as sesame seeds now he's doing. So, like peanuts for some people are a huge deal. Whole life you cannot have peanuts. That is because the underlying problems are not addressed, I feel, So, so I hope that was helpful.
Okay, that's really helpful, actually, because some of the stuff that I'm hearing about Ryan, your son, it's what my son has.
Ah, okay. Okay. Yeah. All right. Anyone else has any questions?
Yes, doctor.
Yes, Marianne.
Yes, good morning, everybody, and good morning, doctor. Thank you, really. We really, really appreciate all the good things that you've given us. The question I have, my son, he has all kind of issues and all kind of diagnosis with, the Lyme, this and this. And right now we are in the protocol, full protocol, almost for 4 months right now. I'm not lying. He's doing great. He's improving many ways. His wise, his understanding, his speech is increasing, very good. But still I'm dealing with some days hyper, bolting, crying, whining. He sleep good. Even lately we noticed, even before he was, if I don't wake him up, he used to do bedwetting. Lately we don't have that issue. He wake up by himself. He go to the bathroom, or he wakes me up, that tell me that he need bathroom clearly. But I am dealing with hyperactivity and bolting, crying, sometimes show his skin haze and itchy, and I couldn't figure it out yet what to do with that.
Okay.
If that makes sense.
Yes, absolutely, Marianne. So, first of all, I am really happy to hear of so many improvements in only 4 months.
Mm-hmm. Yeah, well, he's doing great. Otherwise, especially when he's home, I don't have any issue. I don't feel that he's different, with my other kids. Even lately, we noticed that he's asking to play with the kids, like asking his sibling, his sister, come sit with me, sing with me, play with me. That is huge for us. It's a little maybe for other people, but that's huge. If you tell him not to do that, it's easy. He might follow direction. He might not, but still he's right there. His understanding is pure, clear. If you tell him, go get something, do that thing, don't do that. Before he used to cry a lot, and that made me so upset, so nervous. Was amazing. Take him to the playground, playing with the many kids. He don't have the old sensory that he used to have, holding his ears, not able to play. When he become aggressive, he used to push other, peers that's close to him. We have challenging at school. When he goes to school, they will tell you, oh, he has a tantrum because of the devices the kids has, all that kind of thing. And that's the hyperactivity that I see when he goes to school.
Okay, I understand. All right, so there are two possibilities. One important thing that you mentioned, Marianne, was that at home he seems to be greatly improved, right? Now
yes.
you've been on the BioNexus protocol 4 months, so whatever improvements that you're seeing at home, and that's a lot of improvements, those will stay. Okay, those will not go anywhere. That's what I've always seen with the BioNexus herbal protocol. Because we are doing herbals, plant-based treatments, there is not really a whole lot of back and forth. Whatever gains you have, they will stay with you. I'm wondering if at school he is having exposure, because what you're describing is a flare-up. Okay, because if it was die-off, or, a Herxheimer reaction, because of the antimicrobial herbals, which are killing all of the bacteria and the yeast and the mold that we found. If it was that, he would also have the same problems at home. But at home, he's showing tremendous improvements with language, cognitive, staying calm, settling down, focusing, studying. But in school, there could be a problem. Now, another thing that I'm thinking, based on what you said, was EMF sensitivity. So if there are like 20 children which are on their devices together, and the teacher is on the device, right? And they have a wireless router in the classroom. Okay, then that is a lot of EMFs in that one classroom. So I have seen, sleep disturbance. I have seen body rashes. I have seen head banging behavior, aggressive behavior in children that are EMF sensitive. Okay, now one thing to understand is, as the body is getting better, right? With the herbals, we are cleaning out, we are calming him down, we are rejuvenating the brain as well, and the gut. So once the body and the immune system start to feel good, then they become even more sensitive to any pollution. Makes sense, right? Because now the body's like, okay, I'm feeling great, and then you actually introduce a whole lot of EMF, which is one kind of pollution which our kids are sensitive to. I always mention Brian. I remember we have to travel the world, right, to find answers for his treatment. And so we used to visit, we had to go to the airport many times. And within, even if we were 3 miles away from the airport, his head would start shaking. So much EMF sense, he would go like head shaking, and sound will come from his mouth. So he would have vocal stimming, he would have motor tics. It lasted until we were able to calm down his PANDAS, because PANDAS is autoimmune, and one of the sensitivities that our kids develop, because the brain is involved, right? PANDAS is autoimmunity against the cells in the basal ganglia in the brain. Okay, so this is something quite serious which we have to consider. It takes time. So any electrical activity which is disrupting the normal electrical activity in the brain can cause symptoms to come back up. Okay, so what is the solution? One thing I forgot to mention, it could be EMFs, which Mary, and I saw you nodding yes, because that's what it is, unfortunately, in most of the classrooms. Second is also, if it is an old building, it could be mold exposure. Okay, so what we have done, and what many parents choose to do, is electromagnetic frequency protection for the child, as well as providing one air purifier for the classroom. In fact, for my son, in the beginning, as you know, elementary, middle school, it's mostly one classroom, maybe 2, 3. But in college, in high school, it was 5 classrooms. In college now, it is many classrooms and labs and what have you. So for each place, we have provided air purifier. And we have as part of his medical plan, the IEP. Right? So IEP 504 plan, if your child has that, try to make the air purifier as part of it. And don't tell them about PANDAS. I don't think anyone understands.
They don't understand that.
No.
Even if you tell, they don't know anything about it.
No, they don't want to.
Yeah, they don't want to. They know
they don't want to because yes, because it's more work for them.
Mhm.
Okay, I'm sure there are, but there are some wonderful educators out there. I mean, I don't mean to generalize, but that's what I've heard from parents, that it's very hard for educators to understand, like teachers. So what the best thing to do is to say severe allergies.
Yeah, but I talked about that. I wanted order, but they say talk to your doctor and get prescription from the doctor. So that's what I want to do.
Okay.
And that probably a EMF, I'm gonna figure it out, to put that wristy pen and see what's gonna come up. Other than that, he's not bad. He's not bad. I can say for the time that we were running around last 4 years, he's in his best shape. He's growing. He's doing good. To me, because I know where he come from. A lot of people, when they see, they might think, oh my God, he's, but to me at home, he's amazing, because asking what he need, doing what you tell him to do. Before, when he got mad, it was so hard to calm him down, not growing. The food was not going his body before. It was like wasting, his weight was not gaining. And right now he's amazing. He's about his age. He's older than his age, like his body wise, and I'm so happy with that.
Yes.
But one thing, that's sometimes hyperactivity, crying. So thank you very much, and I will join the other people's questions, so I don't want to keep by myself. Let's other people give it time.
Sure, I'll do one podcast with you as well, if you like. I mean, we'll schedule something for later on. But yeah, I'm really happy to hear, and I'm happy to give you some suggestions for EMF protection that we have used, right? So when we talk next time, let's talk about that. We will also incorporate whatever information the school wants. Okay. So I think Dika has a question, right? All right, my dear.
Yes.
Go ahead.
Yes, doctor, I have a question. So when I started the treatment, it was like November 20th. So first month till December 20th, we was doing great. My son was very calm at home, at the school.
Good.
He's been through all the night, like it was perfect. But after we reach all the dose, we started something like he's using to the bathroom all the night. He's waking up. He have sleep disrupt. He have like couple weeks he don't want to eat at all.
Oh, okay.
That when I try to wait, when I slow down the dose, like try to make it twice a day instead of 3 times a day, he's came back a little bit, and then again he go back. I stop about a week, I restart again, but still we have the problem, doctor, like sleep disruption. He's waking up in the night, he's using to the bathroom, then he go back to sleep, then he's wake up about 5 or 6 hours. He may sleep in the early in the morning, he wake up like he have some annoying flare that I've never seen. He have some flare, he's not have a high behavior, but there's something going on.
Yes, yes, I understand. Okay, so after 1 month on the protocol, you saw good improvements, but after that, you are seeing some symptoms coming back up.
Yes.
Right. Also, some new symptoms. Good.
Yes,
now that is actually good news, and it's weird, but I'll tell you why. Because because that is the die-off. Okay. So now die-off reaction is good news. Why is it good news? It means that the protocol is on the right track. It means that bacteria are dying off, and when the bacteria die off, they release a lot of toxins, and it is these toxins which cause the increase in the symptoms. Okay, so it just means that whatever dosage we have given you, okay, that dosage is not enough for the large number of infections that he has. The infections may have been more than what we originally thought. So, if you have like 100 bacteria, for example, right?
Yes.
And I'm giving him herbals for maybe 50 bacteria. Okay. Then what happens is, as you increase the herbal drops, more and more bacteria will die, more than we anticipated. So that is what is happening. So yes, what you did was good, because your protocol had directions on how to handle a die-off reaction. So you reduce from 3 times a day to twice a day, right?
Yes.
Okay, so that's good. Then what you should do is, actually, let me see, Rueda, can you mute your, yes, please mute your device just for now. And I did see your raised hand. I'll come to you next. Okay, so Dika, right. So let me see. Good. So can you hear me, Dika?
Yes, yes.
All right, good, yeah. So what you should do is, if you're doing antimicrobials and anti-inflammatories, you should reduce all of them to just 2 drops.
Oh, okay.
Reduce them all to 2 drops, just once a day.
Okay.
Okay. Make sure that everything else you're doing, the binders, everything else you're doing. Okay. So just reduce to 2 and not 10 drops.
Okay.
Right. And then do this for 1 month.
Okay.
Then the body will get used to it. Right. All the others, I hope you're also listening about this, solution for die-off reaction. This is one of the solutions. So for 1 month, give him the low dose, and then you can slowly start building up again. Okay. So do that. Now, wait. Sorry, wait. So that is it, because it sounds like die-off, because he made improvements in the beginning. Okay. Now, another thing to understand is it a flare-up? Because if anybody in the family got any cough, cold, COVID, flu, sore throat, that can transfer to your child. And that can trigger PANDAS, because frequent bedwetting and aggression are classic symptoms of a PANDAS flare-up. Not eating properly, okay, because many children with PANDAS even experience a lot of eating disorders. So it could be die-off, it could be flare-up. So if it is a flare-up, a PANDAS flare-up, then you have to go back and check who it was that got ill. Because sometimes it is the family members who are sick, and the child comes in contact. Because if your child is doing so many herbals and he's doing 10 drops and he's improving, it means the herbals are helping with the immune system. Okay, so you have to be able to distinguish. That is something for you to understand. I have 2 podcasts which I have recorded. One is called as the PANDAS Flare-Up podcast, and the other one is called as Herxheimer reaction. Herxheimer, Herxheimer, is the scientific name for die-off. So please watch those 2 podcasts. It will be very helpful. Okay, I think it's for all of you to watch, because it's important to understand if there is re-exposure, right? Re-exposure means that you should not reduce the dosage, but you should actually treat what the child has been exposed to, or if anybody else in the family is sick. Often what happens, like many of us do this, I hear this from many parents, that the other child has sore throat, but the other child is neurotypical. So, mom thinks that, okay, my other child has good immunity, he has sore throat, he will manage. So for a few days, right, hello? Right. So for a few days, what happens is that the autistic child is exposed to the infection of the neurotypical child. So while the neurotypical child's body can handle it, the autistic child's body is still on the BioNexus herbals and still building up the immune system to the point where we want it to be. Okay? So please explore all these possibilities. Hi, Sudhi, how are you?
Hi, how are you doing?
Doing well, thank you, my dear.
Yeah,
How can I help?
I hope we will meet you on April sometime. We have appointment with you. My
Awesome.
question is, what cause my daughter has a speech delay? We did a lot of things. We changed the diet. We taken a lot of tests, like green lab test for organic acid test.
Yes, good.
Yeah, she came out like several infections and we treated, and she's doing great now. But my question is, she never had a fever since she was like 2 years. Now she's 6.5.
Okay.
But the last time she has a fever was when she was 2 years.
Wow.
So
and
I'm
how old
wondering
is she now? Sorry, how old is she now?
She's a 6.5.
6.5 to, okay.
Yeah.
So that sounds like immune system suppression and dysfunction. So I don't know what infections you found, which we will review at your appointment, I'm sure. But
Okay.
there are many infections that suppress the adaptive immune system that cause immune dysfunction, and exposure to mycotoxins, mold toxins causes.
She had a lot of macrotoxin.
She did. Okay.
Yeah, we treated
Right.
her. She has a big delay, but now she's doing well.
Good.
Right now we have a little bit anxious. She making aggressive, sometimes crying. So that's why we have an appointment for you.
You have an appointment in April, right? Okay. Yeah, that's fine. What is this? This is still January. Now, I know that my staff usually sends out reminders, but Sudhi, if you fill out all the paperwork, okay?
Yeah, I did it.
And you send it back in and ask my staff to put you on the cancellation list.
Yeah, they did it.
They did that?
Yeah.
You're on the cancellation list?
Yeah.
Oh, excellent. Yeah. Okay, yeah, because it's winter time here, so we do get our fair share of coughs and colds and cancellations, reschedulings. So it's good to be on the cancellation list.
Mm-hmm.
So hopefully I'll see you soon then, right, about that. So what is your question actually? Your question is, can she improve, or what is your question?
She is improving a lot of area, but my concern is why she didn't get a fever, even we had a corona.
Why? Yes, so that is a big concern. It means that I'm very happy that she's improving, but looks like there are some areas that have not been addressed. So and also remember, it takes time for the immune system to come back online, because with biotoxin illness, right, mold exposure, biotoxin illness, your inborn or adaptive immune system is affected. With infections, your inborn or innate immune system is affected. With infections,
she has a airborne, higher bacteria in airborne.
Okay, so with infections, your adaptive immunity is affected. So when both parts of the immune system are affected, that's where you will not see a strong immune response like fevers and what have you.
Okay, thanks.
Okay, so it'll come, because we know that there is no cure, because I'm an autism parent myself. We know that there is no cure for autism. because there are many genes that are involved, right? But
Yeah, I also tried. I suspect the one time if he has a heavy metal, I did a test,
yes,
and she came out the normal. Like it's not
that
something.
came out normal. I don't
Yeah.
know. I don't know. Sometimes, children need provocation testing. So I'm going to discuss that with you as well. Additionally, one thing that I found, in the Somalian and Kenyan parent community, you're like very knowledgeable. You guys do a lot of research, and many treatments have been tried. Marianne was. I think it was Marianne who mentioned that, for 4 years, she has been trying different things for her child, and she hasn't seen as much improvement as much she saw in the last 4 months on the herbal protocol. So that can also be, why? Because doing things in the right order is very important, and sometimes doing everything together is important. Like even if you're doing small doses, but if you're treating everything together, that becomes important. So once I analyze your child's daughter, you said, right? Once I analyze your daughter's labs that have been done, and whatever other treatments you've done so far, then we can further customize her protocol.
Thanks.
You're welcome. All right, Rueda, if you're back on, I'm happy to take your question.
Hi, my name is Rueda, and I have a 4-year-old. He's autistic, and I am new to this. This is the first time, and I just find out that my son, he has autistic, and he doesn't eat any solid food. He only eats baby food.
Okay, how old is he?
He's 4-year-old.
4 years.
And yeah. And we started right now with the therapies, APA, speech, and OT. He was doing fine. He's bubbling. He says like some words, sometimes in a clear, sometimes not a clear. So I wanted to do some lab testing, but I don't know where to start.
You don't know where to start, okay?
Yeah.
Do you have a practitioner that can prescribe the labs for you?
Yeah, he has his primary doctor, but no.
So, okay, so if your question is about labs, that's easy because, usually you would need a practitioner to prescribe them. And more importantly, to interpret them. It needs to be, because interpreting labs, right? Interpretation is like an art, like, how to connect the dots, like exactly what's going on with the brain, with the liver, with the kidneys, with the immune system, what's going on with the gut, of course, and how all of these are connecting. Often with our children, the lungs also have to be looked at, because there may not be adequate oxygen delivery. We have to look at his red blood cells. So we have to look at infections. We have to look at toxins. And you must have heard me mention to Dika that eating disorders, okay, not eating solid foods, they are quite common with children with underlying infections and problems, right? Children with PANDAS, with biotoxin illness, because of certain areas in the brain that are affected as a result of the PANDAS associated autoimmunity to the basal ganglia. That can happen. Additionally, Lyme disease and co-infection, especially Lyme, they can cause muscle weakness. So often, children right after birth will have difficulty latching on and being able to breastfeed, being able to, and as they get older, being able to eat solid, right? Because the muscles are affected. Often with Lyme disease, right, cranial nerves are involved, right? There is some kind of underlying neuropathy. One side of the face, the muscles might be weaker than the other side. So there are various imbalances which come about at the muscle level.
Right now, before he never used to chew anything, but now we have a feeding therapy.
Okay.
He chews fine, but for him, instead of eating the food, he will run away. But I teach him every day new, like he takes small bites, like he would take small on his tips of his fingers. But like the other, so we're working on his feeding. The other question is I have, he has an ABA. They told me that they would use what is it called? Communication device.
Yes.
Is that a good thing to start now? Because
yes.
I want to know because I don't know that much about it. So she said that we will start a communication device because he start being so angry now. Every time he needs something, I don't understand what he needs. He takes my hand and take me where he needs something. If I cannot find it, he will run like back and forth, like jump up and down, and then he will come down himself.
Yeah.
So is it a good time to start the communication device?
Okay, so any kind of communication for the child, Rueda, the fact that he is getting upset when you're not understanding what he wants, that tells me that he is, he's quite intelligent. He knows what he wants. There's a strong personality, but unfortunately, he's not able to communicate. So, I mean, poor kid. So yes, give him any kind of communication assistance that he needs, but with someone with that level of sensitivity and intelligence, I would be sure to treat everything to make sure that all of the underlying issues are treated. And trust me, you will be surprised with the results. Good news. Now, if you're doing feeding therapy, you can ask her if she can use Beckman's oral motor therapy techniques, right? Beckman's, Beckman, right? Beckman's oral motor. So that helps with strengthening the muscles around the mouth, inside, outside, which are helpful for chewing, as well as other reflexes and mechanisms that are involved with chewing and swallowing. Okay, so, sorry?
Sorry, what is causing drooling? He drools a lot.
That is, again, muscle weakness, but it could also be neurological. Okay, so, you have this whole bunch of symptoms which are indicating to me that there is underlying issues going on. Now, remember, Lyme disease and mold illness can cause brain damage. Okay, now at a young age, that can be quite reversible. That's what I've been seeing in my practice, right? And all we are using is herbals.
Thank you for joining part 1 of Autism Moms Roundtable on the BioNexus Health podcast. Join us next week for part 2. You can subscribe for free on most podcast apps. By subscribing, you encourage the algorithms to spread our messages of hope and healing. You may also leave a review on your preferred podcast app or share on your social networks to promote the podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.